Our next presenter, I am so excited to introduce, is Beth Shinn, and is going to kind of bring us into some conversations about research and families, which I think is a big part of homelessness that we don't always think of. So Beth, please share your thoughts.
Well, thanks so much, Caitlin, and thanks to Rhode Island Center for Nonviolence and Peace Studies and to my fellow panelists. I agree with Eric that homelessness is a severe deprivation of human rights, and I really appreciate Rahul's portrait of what it looks like on the ground and his tremendously useful resource for physicians. I'm going to send that to our medical center. I'll be somewhere in the middle. I want to convince you of three things. First, widespread homelessness is not inevitable. It results from policy choices. Second, we know how to end it for folks who experience it. Research has shown us. Third, even if we end homelessness for everyone who's experiencing it today, we'll have more tomorrow unless we change the social policies that generate it. So first, widespread homelessness in good economic times is a relatively recent historical phenomenon. It came about because low-wage workers could no longer afford the rent. And we have solutions that have been proven to work if we're willing to fund them. Back in the 1970s, there was a surplus of housing that poor people could afford. Very few people were homeless, mostly older white men living on skid rows. One book at the time was entitled Old Men, Drunk and Sober. Because homelessness was concentrated in that group, social scientists thought that when those men passed, homelessness would end. But it didn't end. Housing costs rose, wages failed to keep up, and that surplus of housing units turned into a bigger and bigger deficit. In the 1980s, we started to see many more groups of people on the streets: young men, minorities, women, and even families. In the late 1980s, the New York Times ran an editorial series about homelessness that they dubbed New Calcutta. Wags pointed out with some justice that the Times was unfair to Calcutta. But the central point of the metaphor was clear. How, the Times asked, could homelessness be happening here in a wealthy country? The answer is it doesn't need to happen. Research has shown us how to end homelessness for people who experience it. We know how to prevent it for people at risk. We know how to stop generating more. We don't have to pick our way around our fellow citizens on the street, pretending or wishing that they weren't there. The country is wealthy enough to provide housing for everyone. What we need is political will. At base, homelessness comes about because people can't afford housing. Rates of homelessness are highest in cities where rents are highest. And rental subsidies that make housing affordable both prevent and end it. Here's the evidence. I co-led a big study of over 2,200 families we found in homeless shelters in 12 sites across the United States. We didn't have a site in Rhode Island, but we did have sites in Massachusetts and Connecticut. We used a lottery to offer families different programs to end homelessness, and we looked at what happened over the next 3 years. What we found is that giving families access to long-term rental subsidies, typically housing choice vouchers, that held their housing costs to 30% of their incomes, not only ended homelessness, but had radiating benefits for other aspects of families' lives. Rental subsidies reduced food insecurity and domestic violence. They reduced substance abuse and psychological distress. That is, problems that can sometimes cause homelessness were reduced when families got housing they could afford. The subsidies reduced separation of children from parents and improved kids' school attendance and behavior. Affordable housing provided a platform for families to solve other problems on their own. As one mom from Kansas City put it, so for me to actually have a nice house for our children without having to be completely worried about rent for this month, because my husband's trying to go back to school full time and so am I. That way we know we're supported and we don't have to worry about losing the house because we're trying to go to school and work and we're safe, we're okay, and we'll get things back on track. Formerly homeless families flourished without any specialized services. Other studies have shown that giving rental subsidies to poor families also prevents them from becoming homeless in the first place. But what about people with mental illnesses or substance disorders? People sometimes say that mental illness causes homelessness, and it's true that people with serious mental illnesses or other disabilities may have trouble earning incomes that would allow them to afford housing. But why should the penalty for mental illness be homelessness? The reason is that federal SSI disability benefits at a mere $794 per month are too low for folks with serious mental illnesses or other disabilities to pay the rent. And I don't deny that in some cases, substance abuse is severe enough to cause homelessness. But in other cases, people don't hit the bottle until after they hit the street. I'm a college professor, so let me let you in on a secret. You may not know this, but a lot of college students have substance problems too. And no one ever says that they became college students because of their substance use. Lots of Americans have substance problems. You probably know some, but most do not become homeless. Like other mental illnesses, substance disorders can be managed and in some cases reduced if people have secure housing. Shelters aren't an adequate answer here, but supportive housing, that is affordable housing, combined with voluntary services, has been proven to work and work well. Let me tell you about a woman in New York. I'll call her Susan. Susan had a mental illness and she loved her cat. She wouldn't go to a shelter because they didn't allow pets. She had a friend who kept the cat, and Susan lived in the stairwell of the friend's apartment building. When the friend's husband left in the morning, Susan was allowed to come into the apartment, clean up, and play with her cat. You might say that Susan chose to live in that stairwell, but when offered an opportunity for an apartment where she could keep her cat, she jumped at the opportunity. She was lucky to get into a program called Pathways Housing First that gave people with long histories of homelessness and mental illness, often with co-occurring substance problems, access to independent apartments with private landlords without any prerequisites for sobriety or participation in treatment. The program provided wraparound services, medical, psychiatric, and substance services, vocational, recreational services, but only the ones that people chose, because services work a lot better if people choose them than if they're foisted on folks. When we did a study comparing the Pathways Housing First program to programs that require people to be clean and sober and demonstrate that they were housing ready before they came indoors, the Pathways group got into housing faster and stayed there longer. They had 99 fewer days homeless on average in the first year. Other researchers have followed people in Housing First programs for 5 years to show that even people with serious mental illnesses and co-occurring substance use disorders can remain stably housed. Programs like these and some others allowed the country to cut homelessness among military veterans in half from 2010 to 2019. How? Because the Department of Housing and Urban Development and the Department of Veterans Affairs put in the resources, and cities made housing veterans a priority. But no one offered the same level of resources to other groups, so homeless rates among other groups barely budged. So we've shown that we know how to end homelessness for different groups of people who experience it, but we also have to stop generating more. Even before COVID-19, the Department of Housing and Urban Development reported that there were 7.7 million very low-income households in the United States who were paying more than half of their incomes on rent. With so many at risk, all sorts of trigger events, for example, a health crisis, a flood, losing a job, being evicted, or quarreling with someone who's provided them with a place to live, will pitch some people into homelessness. Because housing affordability depends on incomes and rents, any strategy that increases incomes for people on the lowest rungs of the economic ladder or reduces their housing costs will reduce homelessness. Strategies that smooth out fluctuations in income will lead to fewer crises that send people into homeless shelters or onto the street. And because, as Eric explained, racial discrimination puts African Americans and Native Americans at special risk, combating discrimination in housing, employment, incarceration, and the accumulation of assets will also help. There are lots of ways to increase incomes. We can increase the minimum wage. Today, there's no place in the country where a full-time, year-round minimum wage worker can afford the fair market rent for a 2-bedroom apartment, and precious few counties where the full-time worker can afford even a 1-bedroom. We can enhance benefits for people who are disabled to the point that they can afford a modest rental. We can increase the earned income tax credit that adds a small bonus to each dollar that a poor worker earns and make it more generous for people without children. We can restore the temporary increase in the child tax credit that was part of the stimulus and make it permanent. There are also lots of ways to reduce housing costs. The closest thing we have to a silver bullet to end homelessness would be an expansion of the Housing Choice Voucher Program to everyone who's poor enough to be eligible. That's the program that holds housing costs for poor people to 30% of income. Right now, there's only enough funding for about 1 in 4 eligible households, and waiting lists are long. We need to build more affordable housing and allow multifamily housing to be built in more places. And we also need to enforce existing laws against racial discrimination and pass new laws to prohibit landlords from discriminating against people who plan to pay part of the rent with a housing voucher. Research shows that housing vouchers are easier to use in communities that have those laws. Homelessness is the worst manifestation of inequality that puts housing out of reach for far too many Americans. That inequality that leads some to live in mansions and others in the streets is a consequence of social policies that we can change. Homelessness is thus a choice, not by the people living on the streets, but by the rest of us when we turn the other way.
Thank you so much, Beth. Such moving words, and I think really tied in nicely at the end there, kind of bringing it all together. So I want to take a moment to remind everyone that we had 15-minute presentations from each of our fabulous participants, panelists, and now we're going to be moving into the question and answer portion. We have till 12:45 is my understanding, so a little over 25 minutes to go through Q&A. So I would love for people, if they have a question, to either put it in the chat or in the Q&A. You should be able at the bottom of your screen to click Q&A and then submit them there. I've also prepped a couple questions if it's a little bit quiet at first while people kind of get the urge to go put in a question. So I'm actually going to do a quick question, not seeing anything in the Q&A that's really for all of you. I think some people here that are participating, some of this may be a little bit new to them, some may be more familiar, but I think we all have expectations about homelessness in the work we do, but there are often surprises, things we didn't anticipate. And I'm wondering for each of you in your profession, in your work, what's been something that surprised you, that you encountered it, and whether it's big or small, that you didn't really think about, that's something that challenged your assumptions. So I'm wondering if anybody has anything they'd like to share on our panel about something that's kind of surprised them in this work and, you know, related to your topics.
Mm-hmm. I'll start. Something that no longer surprises me because it's been true for a lot of years, but surprised me when I first learned it, is the age at which you are most likely to sleep in a homeless shelter in the United States. Infancy. That is, infants are the people who are most likely to be found in a homeless shelter. And it's easy to understand why, because, you know, infants are a blessing, but they're also costly. They outgrow their clothes every time you turn around, but they also require care that either takes a parent out of the workforce or requires the parent to pay for that care. And so that's often something that people find shocking, and I found it shocking when I first learned it.
It's a really good point, and definitely something emphasizing the intersection of rights, that we may see more of those infants in homeless shelters, given certain leaked opinions from the Supreme Court. And that may, you know, we're definitely worried about that being a potential implication of a reversal of Roe versus Wade, is a, you know, the spillover effects into infant homelessness and family homelessness. I'll also just say that one of the things that's sort of disappointingly surprising maybe shouldn't be surprising is the resistance of people to facts. That you know, with everything that Beth laid out in her presentation, you can see if we are able to make an argument on the merits of evidence-based policy based on research, we win every time. It's so clear that it's much better for individuals, it's better for communities, it's more cost effective to provide housing for everybody who needs it than to let people live on the streets or even in shelters. Emergency shelters are not permanent housing, and trying to use them as such is also, just going to lead to bad outcomes. But it's so often that we can't even get to the merits of the arguments because people are so set in their these mindsets, that these myths that we have in America, that if you work hard, then you'll get ahead. And so if you haven't gotten ahead, it must be because you as an individual haven't worked hard. It's something, an individual flaw in you rather than a flaw with the system as a whole, and something that rather than we're focusing on individual responsibility, it's our collective responsibility that's really failed. And so, I don't have any silver bullets here. If people do, I'm looking for them. But that's one of the biggest challenges that I see in dealing with homelessness, is needing to help people get over that mental hurdle and shift the focus. That's very, been very deliberately, people have been misdirected in that direction, and in order to be able to just even have a conversation based on merits.
I want to echo both of the comments made by Beth and Eric, and also say that I think for me, one of the most surprising features of when one of my patients is housed is first, the sense of dignity that they gain. When you're working with people on the street, you don't necessarily understand or sense that dignity has been lost. I mean, intellectually that makes sense, but emotionally, when you're talking with someone, that doesn't necessarily come across. And yet, when someone is moved from the street into housing and wants to invite people over and is excited for their new dinner table and pots and pans and begins to host their kids there, or whatever else, you begin to realize there was dignity that had been lost, and it had just been hiding under the surface. And that pain that a lot of people carry with them and are embarrassed to expose. As a physician who is often privy to some of the most intimate secrets and vulnerabilities in individuals' lives, rarely does someone tell me that they're, quote, embarrassed to be living on the street or whatever else. And it just feels like I think Beth and Eric both said it's sort of the ultimate human right violation to be without a home. The second thing that often surprises me is the loss of community that can happen. So Beth and Eric have talked a lot about sort of younger people experiencing homelessness or being in shelters, from infants up to that 9% of college student statistic that Eric shared is quite sobering. And I think another reason to think about intervening earlier and prevention is because over time, people start to develop social networks because they have to. We all need a social network. And when you've been living in the streets for decades and all of a sudden come into housing, I have found among my patients that it can be very hard to live in that type of isolated setting. And so that's where, I think a lot of people, individual responsibility, that notion might come into play, where people begin to say, well, now they have a house, why don't they just stay there and watch Netflix all day or do whatever else? And people form these beautiful, strong connections that allow them to survive. And you know, the more time an individual spends out there, the harder it can be to sort of readjust, I think, for some. I don't want to generalize, but that's the second piece that's been surprising and sobering for me to see.
Thank you so much for that, Rahul, and all of our panelists for contributing. We have another question. Frank Carini asked, as a journalist, I often hear that people who claim in some form or another that they kind of want to live on the streets, and you know, how do we make them live into housing? How do you address such claims? So I think the question is, are people who are potentially living outside, is that what they want to be doing? And then, you know, how do we make them live in housing? And I'm wondering if anyone wants to try to give their sense of that.
It depends on what's on offer, right? If what's on offer is a dormitory where you're not allowed to be with your loved ones, and where you can't bring your stuff, and where you have to give up your pet, and where you're worried that your belongings, the meager belongings that you're allowed to keep with you are going to be safe, and where you have no privacy, then some people will prefer to be outside. And if what's on offer, and people believe that it's on offer, it's really on offer, is an apartment, a very modest apartment, you know, a single room occupancy sort of apartment, but where you have a door that closes and where you can have privacy and where you can have control, people will jump at that. And I think that transition into housing, as Rahul said, can be hard. You know, if you have a social network on the street and then suddenly you're removed from that, the kinds of services that are available have to include some recreation and some opportunities to be with other people. But very few people really want to live on the streets if the alternative is a place of their own.
Yeah, I would just add two things. First, if you know, this notion of service resistance is obviously the premise for a lot of criminalizing policies and bad housing policies in general. But if you look at the fact that in every community that offers public or subsidized housing, you've got waiting lists that are, you know, 10, 20 years long. And when those waiting lists open up, you know, you've seen these kind of like line around the block, mad rush to get, like, if you're offering housing, that's what people want, and people are lined up for it. If people aren't lining up for the services you're supposedly offering, it says a lot more about those services than it says about the people rejecting them. So what people need is dignified housing, safe housing, adequate housing. And if you offer what they need, then they will take you up on that 9 times out of 10. And we saw the evidence of that during the pandemic. We were able to get the CDC to say, state the obvious, which is that taking people experiencing homelessness out of encampments and putting them into congregate shelters in the midst of an airborne pandemic would, you know, increase the rate of spread and not be a safe place. And so people needed to be placed, if they were going to be taken off the streets, into individual housing units, into hotel rooms. And we got FEMA to provide 100% reimbursement for those hotel rooms. So at that point, communities had really no excuse not to be putting people, you know, they could house the entire homeless population of their community in hotel rooms entirely on the federal dime. And some communities took advantage of this, and where you saw that 95% of people who were offered this took it. So as opposed to, you know, 10 or 20% uptake rates for shelter offerings. And so really, if you just see, you know, as Beth said, it's not that you need something extravagant, just the dignity of a private room with a door, you know, your own bathroom. That's what people need. And so so there's evidence that shows that it's not really that people are service resistant, it's that the services are people resistant.
I want to echo both Beth and Eric, and also say that I think this is where there are limitations in terms of talking about scale. Beth had made that point that, if we just increase funding for vouchers and other types of subsidies, then we have a solution there. And then beyond that, sort of more downstream, I think it's the responsibility of each local community to figure out how to create housing authorities, complexes, units that respond to the needs of individuals, sort of as Eric was saying, like failure of the services offered. And I do think it can be challenging. Once you get down to that micro level, there are a lot of analogies with health, or parallels with healthcare, where it feels like the organizations that are particularly successful are the ones whose sort of staff understand how to individualize the care they're providing, whether that be something about the unit, or considering an individual's prior trauma, sort of exposure to the carceral environment. So let me sort of change my approach to the way in which I talk to you, or let me adjust how often I come in for a housing check if that's part of the unit. So I also think that sort of more attention needs to be paid. And I think, Caitlin, your organization in particular does a really good job at this. And I'm really proud of our local organizations here in Rhode Island, but you take care in really thinking about sort of a trauma-informed approach, which feels really important.
Thanks so much, Rahul. And I think the end of the day, what everybody wants to is personal choice and kind of where they are and how they live their lives. And that's something that's really even part of our Constitution, the founding of our country. So thank you for that compliment. And I echo what everybody else has said.